Welcome to Education, Trials and Triumphs, the podcast that dives deep into public education from kindergarten to grade 12. My name is Maria. I am a life coach, a school counselor, and passionate advocate for educators, for teachers, for students, and for the future of public education with over 30 years of experience in the system. Each week, we explore the challenges, the victories, and the stories that shape our schools. We're here to uncover the trials, celebrate the triumphs, and reimagine the future of public education. Let's dive in. As school counselors, we often see students that are struggling, and we offer support, but here's the hard truth. Sometimes a student needs ongoing care. When a student needs a therapist, that's when we as counselors step aside and refer them to outside professionals who can provide what we can't, like registered clinical counselors. These specialists have an expertise to dive deep into complex issues kids are facing and offer the kind of sustained care that they need. But when do you know it's time for a referral? What exactly does a clinical counselor do that's different? Today, we're answering those questions, and trust me, you won't want to miss what's coming next. We'll also break down how parents, caregivers, and educators can be active partners in the process. Today, we have the perfect guest to help us understand how it all works. Gabriel Patridge is originally from Argentina. He's a registered clinical counselor with the British Columbia Association of Clinical Counselors. Before becoming a psychotherapist, Gabriel was a practicing physician for 15 years. His clinical counseling services include individual, couples, family parenting, addiction, and immigration issues. His theory orientation is rooted in psychodynamic psychotherapy, and he specifically subscribes to the attachment theory. This theory examines how our relationship with our caregivers has left an impact on our unconscious and what that means in our present-day behavior and interactions with others. Gabriel is a member of the Canadian Association for Psychodynamic Therapy. Welcome, Gabriel, to my podcast.
Thank you, Maria. Pleasure to be here.
Yeah, so let's dive in. What is a registered clinical counselor?
A registered clinical counselor is a highly qualified counselor who belongs to the BC Association of Clinical Counselors, BCACC, and they meet a stringent graduate level education and training standards. The minimum education requirement is a master's degree in counseling psychology or similar. The practitioners should meet other required clinical standards. This is considered the gold standard for master's level psychotherapists and counselors. Now, the issue is that counseling is a misleading nomination because it means the job or process of listening to someone and giving that person advice about their problems, which is the opposite of what we are supposed to do. We don't give advice like life coaches or lawyers do. Help that individual find their own strengths to overcome barriers or what their true desires are. Like British Columbia, Saskatchewan, or Manitoba, counseling therapists are not regulated by a government authority. Therefore, there are no regulations around using the word counselor. People can say they are counselors or therapists even if they don't have a training in the assessment or treatment of mental health challenges. What does this mean? It means that anyone can call themselves a psychotherapist or counselor in those provinces. There is no minimal education, training, supervision, or experience requirements. So as such, it is important to look for someone who is a licensed professional who has the qualifications to provide therapy. So make sure when you're looking for that type of professional, for mental health professional, if you're looking for a counselor, that you are contacting at least someone who has a master's degree in counseling psychology and is registered with a professional association.
Are you saying that people can call themselves a counselor, not have the official training to be a counselor, and there's no association or regulatory body that's supervising this?
That's true. In these three provinces or some people have diploma in counseling, which is not the same as a master's degree in counseling. So they don't have the training. It's a 1 year, I think it's a 1 year program offered by the VCC, Vancouver Community College, and they can call themselves counselors. Usually they work for associations that offer help for people with addictions, but it's not the same as seeing someone who has a master's degree.
Yeah, I had no idea. I just assumed that everybody who was a counselor either had a diploma from UBC or one of the universities, or they had a master's degree with some branch of, like with some methodology that they're following, like psychotherapy, for example.
It is important. That's why I'm making this clarification that they can be aware. People are not aware of this.
And how does the role of a registered clinical counselor differ from other health professionals like a psychologist?
Yeah. So each one has a different form of training and education. At the end of the day, it's going to be you're going to be getting something very similar. A psychologist is usually they have experience in research of a specific topic. They spent more time in academia focusing on areas of interest. And some psychologists have a master's degree, while others have doctorate degrees, but they're not medical degrees. Don't get confused just because they're called doctors. They will be called doctors, but it's a doctor in psychology, not a medical doctor. And so they're going to have different designations depending if it's a doctorate in psychology or a doctorate in education. And they don't have the ability to prescribe medication, but they can diagnose. So that's the difference between a psychologist and a counselor, registered counselors, that they can diagnose. They're using the Diagnostic Statistical Manual, or DSM. Now, the difference between a psychologist and a psychiatrist is a medical doctor. They are medical doctors. They have been through medical school, as do general practitioners, but with a specialization in mental illness and pharmacology, and will have ND after their names. And like every physician, they were trained to assess, diagnose, and provide treatment, in their case with medication. They treat mental disorders with medication and in general with a limited conversation. They are reserved for more severe mental disorders like schizophrenia, psychotic symptoms such as delusions, hallucinations, bipolar disorder, or advanced dementia, just to name a few. If you see a psychiatrist, most likely you will leave with a diagnosis, if that's what you're looking for. There are a few psychiatrists who have gone beyond their medical training and specialization in psychiatry and have trained in psychotherapeutical theory, which, if you want, I can explain later what exactly that is. In Canada, psychiatrists are the only ones who are covered by the provincial health insurance.
Okay, so what I'm hearing is that anybody can get like a doctor of psychology, but that doesn't mean they're a medical doctor. And when you go to become a medical doctor, at some point you're required to specialize in a specific field. And one of them could be as a psychiatrist. Only doctors trained as medical doctors have a specialization in psychiatry can offer prescriptions to their clients. And
Exactly.
a registered clinical counselor does have training.
Everybody has a training, only that at the end of the day, the three ones that I just mentioned, the psychologists, the psychiatrists, and the clinical counselors, we offer the talking treatment. The difference is that the psychiatrist can make a diagnosis and provide medication. The psychologist cannot provide medication. They can provide a diagnosis.
Yeah.
Yes.
Okay. What types of issues do registered clinical counselors typically help children and families navigate?
Okay. So usually when someone's going through a depression, anxiety, conflict of any form, that's when they want to, and if they're not going to be medicated, they can come to a registered clinical counselor, and the clinical counselor, depending on the school of thought, the psychotherapeutical treatment that they offer. And we all have different school of thoughts that we follow. In my case, it's psychodynamic and attachment theory. Others use, which is more popular, CBT, cognitive behavioral therapy. So there's a variety of schools of thoughts which will be offered by the clinical counselor. And that is the treatment that the individual will go through.
Yeah. As I work as a school counselor in an elementary school, and we often have parents expecting us to provide ongoing therapy for kids when in fact that's actually not our mandate within the school system. We work at 3 different schools. I have caseloads of, I would say, 30 to 50 in 2 schools and a caseload of under 5 in a very small school with 70 kids. And what I see is that I'm not able to provide ongoing therapy, coming to talk to me sessions, or where the anxiety is at the point where we need outside support. Because there's anxiety, like daily anxiety, and then there's like more of a clinical anxiety.
Yeah. Anxiety sometimes is misleading because anxiety is part of life. It can't function when it's constant, there's something there that doesn't allow you to enjoy little things in life.
Mm-hmm.
In the case of children, it's different because they can't describe what they're going through. They can't put it in words. There's a limitation of language with children. So they're going to be acting it out in some way, either at school or at home. And that's when the parent notices there's something different. There's something wrong. Something is not really working here. Mm-hmm. And that's when they should be making a consultation with a professional.
When the level of was presenting, for example, sad thoughts or worry thoughts or anxious thoughts are having a direct impact on their day-to-day functioning. Like they're not able to maybe get up in the morning, maybe come to school, maybe do their work at school, pay attention at school. They're closed off to the relationships with their friends. They're becoming more and more isolated. When I see that their level of mood, whatever that is having a direct impact on their ability to just function on a day-to-day basis, that's when I typically will refer the parents to an outside counselor.
Okay.
And our mandate at the school board is to refer kids and families to Vancouver Coastal Health Youth Clinics, as the school board doesn't support us to give referrals for specific clinicians that are private.
That's the limitation that a school has.
Yeah.
You can't offer a regular weekly, which would be the best scenario where the child or anyone sees someone in a weekly basis, because there's a connection between the first session, the second, and the third. There's a flow. So ideally, that's how regularly you should see a professional. That's the limitation that a school has with so many students.
Absolutely. And let's say that we don't notice anything happening at the school level, but at home, they're noticing that their child is more withdrawn or not sleeping well or not eating well. At what point would you reach out to a registered clinical counselor for support?
That's one of the signs that the child is acting out. Something is happening in that family dynamics. The child is expressing it with the symptoms that you're describing. That's the moment when they should take the child to a professional, any professional. And it has to be, of course, someone who specializes in children. In my case, I don't see children. It's a different way of working, especially the younger they are, focused to expressing their issues through play. So I only work with words.
Yes, what's your age group? What's your minimum age?
Usually it's going to be a teenager, so 12 and up.
Yeah, and what's the most common thing that parents reach out to you for in regards to getting support for a teenager? What are the common themes or topics that come up with teenagers or concerns?
Usually a teenager has a lot of conflicts at home because they're transitioning from being a child to being an adult. That's difficult for everyone in everybody's life because that development that they're experiencing, there's physical, hormonal changes, psychological changes, they can see that they have to go through the process of mourning that they're leaving behind their childhood. They have this conflict of wanting to feel independent, but at the same time, they're still very emotionally and financially dependent on their parents. And so they're in conflict with that. That's why there's so many conflicts at home, because they have a tendency to say no to everything. And some parents don't know how to deal with that.
And so do you work with the teenager? Do you work with the parents and or caregivers? Do you work with the whole family? Like, how does that come about?
Depends on how the parents approach this. Ideally, I would work just with the teenager, but if there's a possibility of explaining to the parent that they have to understand and have a communication that allows the child to express themselves, that they have a place where their words, their needs are as important as what the parents need. So there's a possibility of negotiation, that things can be negotiated, that it's not a rigid, it's my way or no way because this is my home, because then they learn that life is about negotiating. And we also, I prefer focusing on the teenager and seeing how they can deal now with whatever their upbringing meant for them, and how can they manage whatever it is that they're going through.
Yeah, I got that. I know that in my conversations with parents when I worked as a high school counselor, the number one concern that they had was not getting along with their kids and having constant arguments and fights about what to do, what not to do, clean your bedroom, no, I'm not doing it. Or there seems to be a lot of tension between what the parents' expectations are for the teenager and then whether or not the teenager is in alignment with that. And it's often like a positioning of different opinions or different needs or things like that. And I know that when I worked as a high school counselor, I was like, give me any grade with a grade 9, because I don't know what happens in grade 9, but in grade 9, they become oppositional to adults. They don't want to listen to you. They know better. Their friends are more important than you are. Their friends' opinions about things are more important than what you're saying to them. And that grade 9 year, it is something. And I often would tell parents in grade 5 or 6 or 7, just get through grade 9. If you can just make it through that year, you're good to go. Because once that happens, it seems to be a pivotal time for them in regards to moving away from family, moving towards friends a little bit more, not allowing their parents to have the final say on everything or the final opinion on everything. I personally, from a teaching perspective, and when I worked as a school counselor in high school, I found that to be the most challenging year of any developmental stage from kindergarten to grade 12.
Yeah, because the parent has to adapt to the new reality that now they have a child that is not going to be saying yes to everything. Because before there was this phase of idolizing the parent. Parent knows everything. They're a genius. And now it's the opposite. They realize they're human. They're not as perfect as I thought they were. And opposition that you just mentioned, that they want to feel that that they're deciding for themselves. They're not being told what to do. So sometimes everything becomes a no for them. It can be very irritating for the parent.
No kidding. Because what I see is that, we want them to be independent, and yet we still want to manage them and tell them what to do. And really, part of life is discovering for yourself, when I do this or I make this decision, what are the consequences? And we can't protect our students and our kids from all of those consequences. We've brought up young men to respect women and women to respect men and other genders. Like, we've had conversations around diversity and being welcoming and open to all sorts of different types of people in this multicultural land that we call Canada. However, if that work isn't done when they're young, I find that it is problematic when they're older, when those value systems aren't in place.
Provide values, their own values to their children.
Yeah.
And values which can be cultural, part of society. But then they have to accept that the child will decide, what do I do with these values that my parents think are very important? How do I think that this value works for me? Because they might have a different idea.
Yeah.
And that's the part that is very difficult, but we have to try to respect as much as possible. Yeah.
That's definitely a stage that they get into when they become like pre-puberty, or they're going through puberty and they now become teenagers, is they start to redefine themselves, question everything that their has shared with them up until that point, and then come out of that as, this is what works for me, this is what doesn't work for me, because they become actually independent in so many different ways.
Then they're going to be receiving information that is totally different. Of course, parents can see this as a challenging time, or they can see it as a very fun part of their lives, because they can learn from their children. Because their children are going to come with new things, new ideas, new information. And if you're open to listen and there's a dialogue, then everybody can learn from each other.
Yeah. Why does communication break down when they become teenagers? Like, all of a sudden you've got the teen in their room all the time on social media, communicating with their friends. At the dinner table, parents ask them how school went. They might grunt and not give any other details. They become a little bit more withdrawn sometimes. What's it all about?
That's what it's all about, that the parent is always there, opening that dialogue, receiving and saying, I want to listen. I want to know what your life, what you're going through. Who knows that there's not going to be an overreaction for things that perhaps the parent is not going to be agreeing with, but they're going to be open to listen. Then the child doesn't become isolated from the family. They're not always going to go to their friends. They know that they can come home and share whatever it is. And sometimes it's going to be challenges, scary challenges, because now they're exposed to drugs, to alcohol, to sex. And if that doesn't become a big issue, a taboo, they know they can come to their parents and have a conversation about it, even if the parent disagrees. Because, of course, most parents will be concerned about what is it that they're exposed to. But that doesn't mean that if you say, if you do that, I'm going to be reacting in a way that's going to be violent, and I'm going to be so angry. Of course, the child, who are they going to go to for advice? Not the parent, because the parent is reacting in a way that's scary, and they're going to go to their friend. How
do parents or caregivers of teenagers keep those lines of communication?
I think the best way to do it is that they, especially with this challenging things like drugs and sex, is that it's always about safety. Safety, you want to be, most parents are concerned, age appropriate, what is safe for their children. And when I say age appropriate, they're not the same thing as having a 2-year-old who doesn't know how to cross the street, and it's dangerous to do it alone. And grab your child by the hand and teach them to look both ways. You can't do that with a 12-year-old. You can't grab a 12-year-old. You have to trust that you both know you've taught them how to cross the street, and they're going to be looking both ways. Same with a 15-year-old who you try to teach them how to be safe with drugs, sex, with alcohol. What are your concerns? What are the safety that they should be trying to keep if they wanted whatever they choose in their lives? Because you can't be controlling them when they're out of sight. And at some point, you have to trust that your child knows what is safe. You have to trust them.
So this is the key takeaway. At some point, all parents and caregivers of kids need to get to a place of peace where they fundamentally trust their children to make safe choices.
That's what it is. Because you can't control their lives constantly. You can't be over them, because that's not going to be healthy either. They have to make their own choices in life. That's what you want. You want to teach them that they can make the best choices for themselves.
And what does a typical session with a teenager look like, and how can parents and educators support that process?
Depending what they're going through, if what they're going through is a lot of depression, I want them to be able to share what is going on, because the depression is just the symptom. It's the final result of something. So perhaps there's a lot of demands from school, especially their parents. You have to be very good at what you do. You have to get the best marks. You have to achieve or overachieve in sports and socially. And so they have all this demands and this idea of who they should be. And they feel disappointed with themselves because they are not the best. When somebody is disappointed, they feel depressed. And then it's a vicious circle. They don't want to do anything because what's the point? I'm not as good as I should be. But usually that's a very common case. And so we talk about that. That's how can we move from that place? How can teenager, in this case, move from that place and allow themselves some flexibility? So they're not so demanding with themselves. And if they fail, that doesn't mean anything. It's just something that happens. And if they really want to achieve something, they just continue trying.
Yeah, I do see the pressure that parents put on their kids to be the student with the top scores in schools, to be a top athlete, to be a top violinist. And I don't think that adults are quite present to the impact that some of these expectations have on kids. My commitment is that kids are happy and safe and fully expressed. Nowhere in my life have I ever been committed that a kid be perfect or the top violinist or get the top marks in math. And of course, when that happens and the results that you're getting in math, for example, are below average, then that can cause some discomfort, depression, anxiety with kids. And often it is exasperated by outside sources like the parents, like the coaches, like the teachers who have these expectations on kids to be a certain way, rather than accepting them exactly for who they are and exactly for who they aren't. And I think that's the access for connecting with kids. Maybe you had a child hoping that they were going to be like a sports fanatic like you are. And it turns out that your child enjoys robotics or reading and Harry Potter books or art or dance, but that's not what you expected. It really is important that we also support them in the interests and the hobbies that they have and not try to impose our need. Let's say I was a cyclist and I was really close to making it to the Olympics. So that didn't quite happen. And now I'm going to have a child that I'm going to put into cycling and I want them to fulfill on the dreams that I didn't have. That does become a problem. And it's children in that situation are often angry and resentful.
Yeah, because they, in a way, even though they want to become their own person, they want to be accepted and loved by their caregiver. And if they know that they're not meeting that expectation, it becomes an issue or problem.
Yeah, and you want your parents to be proud of you, but at what point do you say, cycling's not my thing, I actually have always wanted to do ballet?
Right. Most individuals have an issue with that if their parents are not supportive in what they wanted in life.
Okay, so Gabriela, I want to thank you so much for joining me today and sharing your incredible insights, your expertise as a registered clinical counselor, and your unique background as a physician has given us a very clear picture of what a registered clinical counselor does and what they don't. I know that our listeners will be walking away with a much better understanding of how to navigate these decisions that we make in regards to our children's mental health. And if anybody who's listening has a clearer understanding of the role of the registered clinical counselor, please take a moment to comment below and share your thoughts. Have you ever been in a situation where one of your children needed outside support? What was that experience like for you? Have you ever worked with a registered clinical counselor? And what was that like? Let's keep this important conversation going by putting comments below. And don't forget to subscribe to Education, Trials, and Triumphs for more impactful discussions about the challenges and victories in public education. Let's keep working together to support our students, our schools, and our future. Until next time, remember, every trial is simply a triumph in disguise. Thank you, Gabriel.
Pleasure. Thank you for having me here.